name is Brendan Butler. I'm a physiotherapist in the west of Ireland, and today I'm going to run through hip assessment. So the first thing I do is start off with my client standing in front of me, and I'm going to get them to walk up and down just to have a look at their gait first. So Simon, if you want to walk towards me here. Good, and I get you to walk down this way again. And what I'm looking for is any sort of Trans-Dellenberg or any sort of circumference walking as she's walking through, or else any sort of hip drops that possibly may be leading to pain. So I get you to walk towards me there. And the next thing we're going to do is we're going to turn around. We're going to have a look at the lower back range of movement, just to clear the lower back before we move on to the hip. Okay, so have a look from the back, make sure sometimes the trousers are in line here with the PSIs, otherwise it can give you some false positives. So have a look from the back, making sure one side is not higher than the other. I'll get you to turn to the side there for me. We're going to have a look at the back, look at any kyphosis, any severe lordosis, that possibly may be causing some compression or some pain across here. And also have a look at, just line up the ASIS and the PSIS and just see if there's any posterior, anterior tilt. Okay, so I get you to face towards the wall here from my side. So looking at the iliac crest here straight across, we have L4, okay, and we can also palpate onto PSIS either side there. So Simon, I just get you to reach down and touch your toes there for me. Good, and back up again. Alright, so we're looking at the way the patient moves down. Are they doing any sort of compensatory movement as they're moving down through it? Does it reproduce any pain going down the legs? Does it cause any pain into the SI joints along the side? That all looks good there. I can also palpate on PSIS either side as they're going down and see if there's one movement and the opposite not. So possibly could be some blockage or SI upslip or downslip. Okay, so place your hands on your sides there for me. I get you to extend back. And again here we're asked if there's any reproduction of pain into the SI joints, or any referral pain down the legs or even down the front if there are some femoral nerve impingements. We can also get to see if the patient is hinging from about L4, L5, so that one can become quite irritated across here if the vertebra above and below have become quite stiff in there. Okay, so the next one side we get you to do is reach down to the left for me. Good, and down to the right. Again, just always asking the patient if there's any pain or any referral nerve sensations. So the next one side, we'll just get you to bring your right knee up into your chest. So we're going to palpate PSIS. Good, and down. And the left one. Good, and down. Again, I'm just looking at PSIs, see the movement, both of them moving quite well. Okay. Might get you to do that again now for my side. Okay, and what we're looking at here is possibly, even if the left glute is quite weak, you might see a patient collapsing out to the side here, again putting a lot of irritation along the lateral aspect of the hip if they're running or walking. So you can often see if glute med or glute max is quite weak in this position as well, if you see that sort of Trans-Dellenberg collapse. You can bring the right knee up into the chest now like that. Good, and again on to the left one. Good, so everything seems quite good there. Okay, the next one I'm going to get you to do is if you bring your right leg up into your chest. This one is called a Stark test. Okay, lean back for me. Good, and back to center again. If we're getting any reproduction of pain here, it may also mean some SI discomfort, or also there could be some spondylolisthesis or spondylothosis along the lumbar spine here, if there's any slip that may cause a lot of pain reproduction. Often common in a lot of ballerina dancers or people who do hyperextension sports. So the next one side of you and face towards me. Okay, can I see you do a wide squat for me? These are all functional tasks I usually do first. Have a look at them. Does it bring on any pain? Are they transferring weight onto one side more than the opposite side? That all looks good there. So if I get you to do a single leg squat, use your one hand. There we go. Good. And the opposite one. Good. Alright. And we can often see if there's some glute med weakness there, as you can see the knee falling in as they're going down. You may often lead to some lateral hip pain or some knee pain on that. We can also see if they have some hip impingement signs and they're collapsing in, if they're playing football, they might get some impingement here. So it might be often good idea to get nice strong lateral hip abductors to keep everything nicely in line. Okay, next one, can I just get you doing some hops there for me? Good. And again, the opposite side, we can also test for any stress fractures here or any reproduction of pain. And we also test lower limb endurance through that one as well. Okay, so just before we move on to the next one, we will just test the neural lines here. Chin to chest, slump down, bring the leg up for me there. Okay. Good. And we're asking our patient any nerve pain on the legs that can often mask the lower back, can often mask as hip pain if there's some referral pain coming down from the sciatic nerve. Alright, so down again. So that's our slump test. Bring the ankle up that way for me. And again, you might get some sensations there. Everything okay there?
Yeah.
Alright. So let's get you lying on your back there for me. Good. So the next one we're going to do is we're just going to test the range of movement of the hip. So first one is just going to bring the hip into flexion, make sure everything's nice and relaxed. Bring the hip forward, make sure, look at the patient's face, see if there's any pain, see if there's any pain through here. That seems quite good, full range. And we'll bring it into 90 position again. I'm just going to do some internal rotation. Again, looking at the patient's pain, see if there's any resistance or any reproduction of pain in here. Good, that seems good. Usually about 40 degrees internal rotation. Usually up into 140, 150 with females into flexion. Okay, and we also test external rotation there. That seems okay. Alright, and we can also test extension as well. So if you want to lie, or we'll actually do abduction while you're here. Abduction, which usually can go to 50 to 60 degrees. Good. Alright, it's important to always test both sides as you're doing this. And we can also test adduction by bringing it across. And again, we can also test if there's any pain in that. In that position, it's good also just to do internal rotation, adduction as well, see if we're getting any symptoms there on that. Okay, if you want to lie face down there for me, we'll just test extension. Okay, so I'm bringing the leg straight up and we can see the extension is okay. Alright, while we're in that position, we can also test the femoral nerve. So Si, will get you to look up towards the ceiling for me. Okay, bend this knee for me. Good. Place my hand here and here, and again I can get some pins, needles, numbs down to the front of the quad, the femoral nerve, any deficits in that. Okay, pop onto your back again for me. Now we've range of movement clear, we can test our strength. Okay, so Si, I'm just going to bring that up there for me. Okay, so don't let me pull it down, hold it there. Okay, so I'm going to test my hip flexors here. It's good and strong. Remember, you're always testing the opposite side. Don't let me push it up towards you. Hold it there. Good. Okay. Don't let me turn it. Good. So test some external rotators, and then don't let me turn it. Good. External rotators there, and internal rotators again. Don't let me turn. Good. Again, if we're getting any pains in that, we often have to follow up on that as well with palpation. Okay. So all's okay there on that. The next one we're going to test is lying on our side to test our abductors. Alright, so lie on the right side for now. Hold that there, try and push it down. Good, okay. That seems good. And then I'll always test the opposite side as well. So pop to this side. Hold it there, try and push it down. Good, alright, always compare both sides. And pop onto your back again for me. Okay, so that's our muscle strength. We're looking for about a 5 out of 5 in your Oxford grading scale. The next one we're going to test is the groins and adductors. So Si, I just get you to squeeze my fist there for me. Again, I'm looking for any pain or any weakness on that. Okay, and again, I usually do it at 0 degrees. Again at 45 degrees, so I'll bring my adductors through range. Good. And again at 90 degrees, so have a squeeze there for me. Good, and relax. It's also good to contract them at full range as well, so Si, I'll just get you to hold them there for me. Push into me here, and again, just as you have the adductor on stretch, it's also good to reproduce pain in that sense as well. Okay, so the next one we're going to do is just get you to do a little bit of a sit up there from each side. So do a sit up. Don't let me push you down. Lift up. Don't let me push you down. Good, and relax. And again, we can just test the abdominal sheath as it comes into the pubic symphysis there as well, which they can often overlap between the two. And to get you to do the same thing again, but rotate into me. Good, don't let me push you down. Good. Right, and I'll ask you to have a cough there for me. Good, just to check if there's any stomach or any groin pain in that as well. Okay, so they are mainly our groin range of movement and strength tests. So we're just going to go into some special tests now. First one I'm going to test is our proximal hamstring tendinopathy, which often can reproduce as pain in sitting for long periods, and often in middle-aged runners who do overload. So Clive, I'll get you to bring your elbows, just sit up a little bit there for me. Elbows here, like that. And now I'll get you to bring your hips up towards the ceiling. Good. Good. So keep the legs straight if you can for me. Legs straight, legs straight. Up you go. Good. And you're just asking if there's any pain here for me. Can you bring this leg up towards the ceiling? Good. And then this one. Good. And you get reproduction of pain up high if there's any proximal hamstring tendinopathy. Okay. Next one, what we're going to do is do some SI testing. So lie back. We'll test our SI joint. So I'm going to apply a distraction on the SI joint. ASIS. Push in. Any pain there? Very good. And again, we're going to try and compress it at the back by doing a compression out the way against our ASIs. Okay. We're also going to do a Faber's test to test our SI joint. So let everything relax. Hold the ASIs here. Push down. Any pain in the back there will give you symptoms of SI joint as well that you might need to follow up. Okay, and also a nice one as well is to do some compression on the SI joint, pushing down through it. Okay. Okay. While we're in that position, we may often get hip impingement signs, flexion, abduction, and internal rotation might bring on pain and some firm sort of end feel on that as well, which is not a comfortable feel with hip impingements. Okay, so the next one what we're going to do is overs, so if you lie on your right side for me. Okay, I'm going to bring this leg back, let it drop down. Good, so this test is testing our IT band, and any possible pain coming down through here will, from tightness of the ITB, will be a sign of ITB syndrome. Okay, while we're on our side is also a good place to check for any greater trochanteric pain syndrome. So we get to palpate along the head across here all the way down through the IT band, and always check on both sides if both sides feel the same as any GTBS pain. Okay, so pop onto your back again there for me. Okay, so while we're in this position, we also get to palpate onto the pubic symphysis as well. So we can work our way down again and just palpate onto the pubic symphysis bone. Any tenderness or pain there may also be a sign of athletic or aponeurosis syndrome or chronic groin pain, as people may see, or osteitis pubis. And we can also get into the adductor tubercle as well, following our line all the way along the adductors and then palpating onto it just along the side there. Okay, and again, that will be very, very sensitive for people who may have some pain along there. We also get to do a few more nerve tap here for tapping along here, maybe some neuralgia paresthetica, or maybe some femoral nerve impingement after car crashes, or any seatbelt compression along here after car crashes, which is a good one to also test as well. Okay, and then if you want to lie face down there now again from your side. Okay, we also get to palpate onto the BSIS there, see if there's any pain along there, and also along on the outside to see. We can also do a distraction as well, just to test on our BSIS, and we get to palpate all the way along our vertebra here as well, if there's any tenderness or further pain down into the hip. Okay, so that's my examination today of the hip and groin. If you have any questions, feel free to pop them through to me, and I'll be happy to answer them. Thank you.